very important thing which people think about is eating sugar will make your cancer worse. I'll answer two things here. One, cancer cells do consume sugar. They are known to consume sugar more than normal cells. It is very true. But in short term, when the person, there is a patient who has cancer, if they consume sugar, there is no evidence that tells us that it will make it worse or grow progressively and make it worse. No, because I get a lot of patients who come to me. They tell me, patients, sons and daughters, very often they'll say, no, I have stopped all sugars for my father or mother. That is a very common thing. But the fact is, that evidence, there is no evidence to tell you that sugar will make it worse. In fact, it cannot also scientifically also, if in the short run, when if you talk about like during the treatment or after treatment, it's not how it works. The How it works is a long term consumption. It is about all about the duration. If you are consuming huge quantity of sugar over the years, then it can lead to excess weight gain, that is obesity, and that can lead to cancer. So that is how the progression, the available evidence is like that. Other evidence which is there is insulin. Insulin is a growth hormone. So if a diabetic patient and a person who consumes lot of sugar produces lot of insulin. I'm sorry, some issues. Yeah. So lot of sugar, a lot of insulin. So that itself stimulates the growth of cells, and that can cause cancer. So that is the theory. So should a person who's diagnosed with cancer suddenly stop all sugar consumption? The answer is no. It does not change anything. Okay. So when I say that, it doesn't mean that you gorge on sugar and consume huge quantities of sugar. Everything has to be in moderation. The in Indian terms, amrita, what we call the elixir, that is also poisonous if you have too much. So there is nothing that is not poisonous. So yeah, poison is in the dose. It is not about which is poison. It's all about dose. If you have too much of anything, it is poison.